This video is for nursing students who are going out to their first acute care clinical and who may have never worked acute care before. In this video, I will introduce the concept of the patient worksheet, also known as the nurse's brain, and show you how to use one. A nurse's brain or patient worksheet is a concise but comprehensive worksheet that acute care nurses use to organize all the information and assessment data that they gather during their shift for each patient. It is a tool that will help you with organizing and prioritizing patient care during your shift, and it also helps you to organize your data for when it's time to give report at the end of your shift. There are lots of different types of brain sheets that nurses use. You can Google nurse's worksheet or nurse's brain, and lots of examples will come up in the search results. This is one that I have come up with that seems to work for me, and hopefully it will get you started with working with patient worksheets in your own practice. And FYI, nursing is always a work in progress, which is why we call it a practice. I am always updating the tools that I use and trying new things, so this worksheet is not set in stone. It's just the newest iteration out of many worksheets that I have tried over the years. So why use a worksheet? Most hospital nurses use some type of worksheet to organize their care. For nursing students, a common requirement to pass an acute care clinical is to care for 3 to 4 patients independently. Generally, the student will start with one patient, and then a patient will be added at the beginning of each subsequent week until they are handling a load of 3 to 4 patients. As you can imagine, the complexity of organizing care starts to increase exponentially as more and more patients are added to your workload. This is where using a nurse brain or worksheet becomes absolutely essential for keeping yourself organized so that you can prioritize care and reduce the chances that you forget or miss something. As already mentioned, patient worksheets are usually used in acute care when caring for multiple patients. I have a bunch of these sheets photocopied and I bring one to each shift. At the start of each shift, I fill one out with all the information from the Cardex. I also take a quick glance at today's orders from the chart to see if there's anything pressing. I then take report from the outgoing nurse and add that information too. As you can see, all this initial data is written down in red. Even before you go in and see the patient, you have enough information to start forming a picture of what basic care your patients might require during your shift. For example, this patient is going to need chem strips 4 times a day. When I go in to assess my patient, I add my own initial physical assessment data in blue to differentiate it from the previous data that we already have. For example, I put initial vital signs in blue. If they have a catheter, I note down how many mLs that are in the bag so I can monitor their output throughout the day. I put down their last bowel movement, etc. Throughout the shift, I add to the worksheet in green. I really try to follow this color scheme because I'm a visual person and it helps me to find information quickly when I need it. For example, if the patient starts deviating from baseline and you have to consult the doctor, it's much easier to sort out initial vital signs from current ones because hopefully you've put your initial vital signs in blue and then the most recent ones will be in green. Despite your best efforts, the worksheet can get rather messy during a hectic shift, and if it's busy, then I use whichever pen I can grab from my pocket. But generally that's the color scheme I try to use to organize things. For priorities or outstanding tasks, I use a highlighter to further reinforce to my mind that these things need to be done or addressed or reported. So this is how I use the worksheet to prioritize care. A lot of the skill of bedside nursing is about prioritizing and juggling conflicting priorities. The worksheet really helps to have a broad overview of your workload so that you can make better decisions. For example, one patient needs to be prepped for a test, another needs insulin with breakfast, another needs dressings done, another needs an IV restarted so that I can give her antibiotics. Which one will you go to first? There's a lot of factors that go into making these decisions, and your answers will vary depending on the details for each patient. Prioritizing care is a skill that you will develop and is a big topic in itself, but for now I hope you can see how a patient worksheet can really help you to organize your shift so that you can stay on top of things and support your patients in the best possible way during their hospital stay. So in conclusion, a patient worksheet will help you have a bird's eye view of each patient so that you can establish patient care priorities. This will help you make better decisions about what care can wait and what care needs to be done right away. And of course, in nursing, nothing is ever set in stone. You have to be flexible. Your priorities will be constantly changing based on the changing status of your patients as your shift progresses. But a patient worksheet will help you to keep all your assessment data handy and organized so that you can stay in control and stay sane as you work to deliver the best nursing care possible for your patients. If you have questions or comments, post them down below and I will answer them if I can. Thanks for watching this video. I really hope that you took something useful from it and that it contributes to your nursing practice. See you out on the floors, fellow nurses.